Doctors of Reddit, what's your thank God they came in for a second opinion moment? Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Dermatology patient here. 37 years old, history of blistering sunburns, ups 30 to 40 over the course of my life, blonde hair, blue eyes. I go to the derm and ask for a full skin exam every damn year. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Not a doc, but a nurse. At a clinic a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology, and that's how they found her breast cancer. She later told us all this in a sweet card she sent telling us if I hadn't told her to advocate for herself she may not have followed up. I am a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. This is an important distinction because often if the doctor forwards your file to a different doctor they'll flavor it with their interpretation. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140, normal, to 119. This in turn caused stroke-like symptoms which were in reality a series of small seizures. Wife went to ER for pain in her pelvic region. Ultrasound showed a mass, probably an ovarian cyst they said. It will pop in time. Leave it alone. Went to THDR about a week later, had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer-free, but WTF. I literally just posted a comment about this because it happened to my friend. Her doc just kept telling her it was IBS. Unfortunately they didn't catch it time, but I know it's very hard to diagnose. I'm glad your wife is now cancer-free. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy shiz. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. This is a I wish I had gotten a second opinion story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially, and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a third-degree sprain, told me it'd be fine. I pointed out lines in the X-ray and he said they were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. I am always impressed when dogs go skateboarding and are clever enough to understand X-rays. Edit. Yo, someone stole my gold virginity. Thanks. He's not that clever, you can really see how it was his fault. Former ER volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent, like, we weren't sure if treatment would take effect in time to prevent it. Declared code blue, all hands on deck, place went from a quiet, empty ER to sheer chaos in a few minutes. There is no doubt in my mind that that gut feeling saved his life. Not a doctor but have had a second opinion save my PP. Noticed blood in my urine and went to family doctor. Family doctor said it was a normal injury and would go away. Went for a second opinion with a urologist and after a bunch of tests they found scar tissue built up in my urethra that was causing inflammation and if left untreated would cause the urinary tract to close. So they removed the scar tissue and I about cried while peeing for weeks after, even while on pain medication, until it healed. But at least I could still pee and that was thanks to the second opinion. This guy was told he had pink eye. He had metal shards in his eye from welding. Ah yes, the daily dose of Reddit anxiety surges through my veins. I'm not a doctor. But I had a fall and went to the emergency room complaining that my arm and back hurt. X-ray, fractured wrist. Cool, now what about my back? Doctor feels around my back and says knots and tight muscles mate, get a massage, it'll help. I wasn't gonna waste money on a massage, and went to my GP a bit of a while later and complained the pain was just getting worse. She ordered scans of my back. Turns out I'd fractured a part of my spine in the fall, too. My dad went to the same ear doctor for around 9 years due to poor hearing, and was told there was nothing wrong. When he finally went to a second doctor, they referred him to the hospital and found tumors in his ears that had eaten entirely through his inner ear bones and eardrums. He needed 4 ops to remove them, 1 every 6 months. If the second doctor hadn't offered their opinion, he would probably have had tumors eating through the back of his skull into his brain. Had a patient that came in because she felt like she had lost a tampon in her vagina. 3 weeks ago. She had gone to see her PCP and been to an emergency department about this and they didn't find anything. She had some drug problems so they probably thought she was tweaking out. I didn't really expect to find anything but there it was. I asked my internist what the cause could be for weird tingling sensation in my left arm could be. She told me it would probably go away. Half a year later I got diagnosed with a brain tumor. Now I've been cancer-free for a year since surgery, but still, Could have been better maybe if I wasn't sent off with ITLL get better. Till doctors don't spend a lot of time fudging off on Reddit. I mean, the post is only an hour old. Doctor said that after my colonoscopy was negative, they could remove my colon, for IBS-C. I asked, horrified, if that would cure my disease. He said maybe. Went to another DR and have successfully managed my symptoms, and I didn't have to remove a body part as a test. Fuck that DR. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. I'm not a doctor, but when I was about 10 I went to my pediatrician for sharp pains in my inner hip, which he promptly dismissed as growing pains. The next day my parents took me to a larger outside hospital where they found a, still growing, golf ball-sized blood clot between my hip bone and femur in a MRI scan, which had to be surgically removed over the next couple days.